Ballad Health Chief Infection Prevention Officer Jamie Swift joins us via Skype once again today. Thank you, Jamie, for being here.
Thank you.
Let's start talking about those rising numbers of hospitalizations. 43% increase in hospitalizations in 1 week. Are we seeing a certain age group? Is this all ages? Can you tell us if there's one area where you're seeing more hospitalizations demographically?
You know, hospitalizations are typically going to be our elderly, but what we have to realize is we're starting to see functional elderly. So, 60, 70-year-olds that are very active in their community, living a very active lifestyle, are now coming in very sick. And that's very different than I think some think of elderly and nursing home patients, and all are important, but we are starting to see that shift as well.
Last week at this time, you said, and I think it was the next day, others with Ballad said that we were at a very critical point in fighting all the numbers to try to keep the curve down, or at least try to flatten it again. Are we still at that critical point, or do you feel like we've kind of moved beyond the critical point where now we're just dealing with the reality we have?
We're critical, and I need our region to understand, we're in a really bad place in our community. We have got to come together as a community and slow this down a little bit to keep our health system from being overrun.
Jamie, I'm hearing from some people, and you are too, I'm sure, and I'm seeing it even myself, where I'll go out and a lot of people are wearing their masks. They're trying, and granted, I don't get out much, but, when I'm in grocery stores, picking up a few things, doing what I've got to do to be out, I'm noticing people are trying, and I think there's just this wondering of what's going on, that we have people who are doing their best, or at least trying to, and they see others, and then they see the numbers. What do you think's going on?
I guess maybe I look through different eyes, but I see a lot of non-masks. I see a lot of masks that are down under the nose. I see a lot of masks to get into a place, and then the mask comes off as soon as someone enters. A lot trying really won't help us right now. It's got to be our entire region doing the right thing, staying home. Masks are certainly effective and help us slow the spread, but masks are not perfect. It is that multiple layer approach that we've talked about. It's masking and staying home, and we're at a place that we really need people to think about where they're going as they're going, to wear their mask and wear it appropriately, and wear it anytime they're out.
And washing hands and social distancing and all the other things that come along with it. And I appreciate your perspective, because you're right. I mean, you do see the non-compliance as well. But I think for those who are doing their best and they just see this going, it's frustrating to think, what else can I do? With that said, I want to talk to you about the idea of flattening the curve. That was the big urging months ago, and the reason was PPE and ventilators. We were concerned about that overrunning. Now I'm wondering, do we have the PPE? Are you seeing the ventilators? Or are you worried about just the staffing to try to take care of the people who are now coming to the hospitals?
We feel really good with our PPE supply chain, so we're confident there. It really is our staffing. Our nurses, our physicians, they're carrying a lot. And so we need our community to come together to help our nursing staff, to give them a break. To the people who are doing the right thing, who are trying their best, who are staying home, that are 9 months into this, I beg you, please don't give up. Please don't get tired. We're all tired. Keep doing that with us. Keep partnering with us. And if you've been a doubter up until now, this is the time that I am pleading with people to join us and help us so we can help our frontline nurses.
I'm curious about those who are hospitalized, and I'm hearing, I interviewed someone last week who's been in the hospital for almost a month with COVID-19 and just can't get those O2 levels to stay up in a sustained way. Are you seeing hospitalizations that are oftentimes protracted over days and weeks, or are these hospitalizations sort of 2-3 day stints? Are you seeing a story that needs to be told there?
Our average length of stay right now is about 12 days in the ICU if they come in with COVID. So, and that's where you really have, when you're running 20 new admissions a day with COVID, and you've got a length of stay that may be 8 to 12 days, that's when those admissions just start stacking up, and it puts a strain on the hospitals.
For sure. All right, Jamie Swift with Ballad Health. Thank you very much for the update. We appreciate it, and we'll be going back to you very soon for information. Thanks for your time. We appreciate it.
Thank you.